Working as an RN in inpatient rehab, I am often called upon to care for patients who have had a cerebrovascular accident, more commonly called a stroke. And I have observed that every stroke patient experiences a unique combination of symptoms. One of the most important tasks that they accomplish while in rehab is learning how to be adaptable. According to the American Stroke Association, left-sided strokes, which affect the right side of the body, cause patients to experience more difficulty with language, both in speech and understanding. Right-sided strokes can cause more behavioral changes that may lead to uncharacteristic impulsivity and may also affect the patient's vision. Now, based upon the type of stroke each person experiences, they will have their own different set of challenges to overcome as they work towards recovery. Identifying the challenges is a crucial aspect of stroke rehabilitation. And a main focus of the rehab team, for example, is balance and gait. Physical therapy is crucial in recovering strength and coordination on the affected side, and if a patient experiences weakness to their left or right, they may require the use of a walker to allow for safe ambulation. Some patients may instead require the use of a cane, a quad cane or hemi-walker. And finding the correct assistive device is one way that stroke patients work to return to some normalcy. Stroke patients may regain their freedom of movement with the help of an adaptive foot brace or the use of a specialized cane. They may adapt to using their non-dominant hand for eating or writing. They may learn tools to adapt their speech patterns or use electrical stimulation of the facial muscles to increase strength and improve oral function. What all of these things have in common is learning how to change and how to adapt. And while each stroke is different and symptoms vary from patient to patient, one common thread is that all stroke patients, their families and friends, must learn to adapt. And it isn't just the physical recovery. People must adapt to the emotional and psychological changes as well. Depression, anxiety, altered moods, sudden mood changes are all common following a stroke. Often I have had patients who feel so frustrated that they feel like giving up on therapy, even giving up on life. Now, patients and family members may experience grief, mourning the loss of the person that they were or that they once knew. Author Delaney Stevenson wrote of her stroke, "While my body and mind were healing, I was learning to be a new person." Just as the body needs time and practice to adapt to the physical changes, the brain also needs time and practice. Neuroplasticity does not return overnight and may take months to return to normal. Regaining function requires setting goals, hard work, patience, and most importantly, an acceptance of the need to adapt.